Good morning, everyone. Thank you for joining me on this very important day for the justice system in Newfoundland and Labrador. On April 18th this year, the Department of Justice embarked upon a process it hoped would improve the justice system in this province. And on that day, an independent review of adult corrections in Newfoundland and Labrador was announced. Today, I'm pleased to release the report and to describe our plan to move forward with the 77 recommendations. I'm extremely pleased with the work of the consultants. They conducted 275 meetings. They presented a very thorough and all-encompassing report, 228 pages with 77 recommendations. And the report they produced will be invaluable for our government as we commence the process to bring about change to the correction system. The reasons for initiating an independent review of adult corrections were many. There were concerns raised by the citizens' representative, by the Auditor General. Inmates, former inmates, and their families raised concerns. Correction officers raised concerns with us. As well, we had the unfortunate circumstances of 2 recent in-custody deaths at HMP. So we were aware that challenges existed within our facilities, and we needed guidance to illustrate exactly what the issues were, and most importantly, how best to address them in a reasonable and responsible and effective manner. The Department of Justice contracted with 2 individuals, Ms. Simone Poirier and Mr. Gregory Brown, both with extensive backgrounds in corrections, with the Correctional Services of Canada. And we asked that they conduct the independent review. Later in the process, Dr. Kerry Carlson, the former executive director of the John Howard Society of Newfoundland and Labrador, was invited to join the panel and use his considerable expertise to focus as well on issues of concern to the inmates of our correctional facilities, ex-inmates, as well as their families. And I want to thank these 3 individuals for their considerable work in this particular matter. Having been in receipt of the report and reviewing its contents, the Department of Justice has acted to commence the process to effect change within the correction system. And I'm pleased to be joined here today by Mr. Don Burridge, the Deputy Minister of Justice, Mr. Paul Noble, the Assistant Deputy Minister for Public Safety and Enforcement. Acting Superintendent of Prisons, Mr. Graham Rogerson, and Acting Assistant Superintendent of HMP, Mr. Don Roach, have made great strides since assuming their positions. The previously closed gymnasium, the previously closed intermittent unit, which is used to house inmates serving weekend sentences, had been reopened after being closed due to occupational health and safety concern. Intermittent inmates now wear institution-issued coveralls and sandals. Both of these initiatives will help reduce the amount of drugs that can be smuggled into HMP. As recommended by the consultant, windows have been installed in the segregation units of HMP to allow natural light into each cell. Also, the special handling units, instead of segregation, will be used for inmates assessed being suicidal. Inmates are now cleaning the penitentiary and have painted some sections. This they have done at their own choice. This is supported by inmates and by correction officers and was highlighted in the independent review. This initiative helps to manage the cleanliness of the facility, which certainly was clearly deficient, as indicated in the report. Daily operational meetings now happen in HMP to ensure continuity of information. A large number of existing grievances, I think about 50% of the grievances have now been dealt with, and a weekly teleconference is now held between the institutional heads to allow for sharing of information. Further work has been conducted at facilities other than HMP. An extra duty post has been created at the Newfoundland Labrador Correctional Center for Women to allow for additional female officer to be present each day, Monday through Friday. The Cornerbuck Lockup has introduced a 7-week trial day shift to ensure consistency in cross-island escorts. Stress management training continues for all operational officers. A tender has been awarded to install new cameras and radio systems for Bishops Falls Correctional Center. An inmate handbook has been written and distributed to all inmates. At HMP, the department, to enhance medical health services, has engaged the services of a psychologist who can supplement the ongoing work of the visiting psychiatrist. Psychological services will also be provided to the Newfoundland Labrador Correctional Center for Women at Clarenville. In addition, a nurse practitioner has been hired for HMP. This individual can prescribe and dispense medications under the supervision of a physician to inmates. It is well known that mental illness is a significant concern when it comes to the health and well-being of inmates. It is my hope that by taking a holistic approach and providing additional resources, as suggested by the consultants, we can alleviate some of the concerns of inmates, their families, and advocacy groups, and provide an appropriate standard of care for inmates with mental illness. For the safety of correctional officers of HMP, we have awarded a tender to allow for slots in the doors of both the segregation unit and the special handling unit. This will allow for safer distribution of meals and toiletries to inmates, especially during circumstances where there are high volumes. Along with the review of adult corrections, Mrs. Poirier and Mr. Brown were also asked to review the search policies of the Newfoundland Labrador Youth Center located in Whitburn. Special circumstances must be given to young offenders, special consideration must be given to young offenders, as the circumstances they find themselves in are different than those of adults. As previously announced, video conferencing measures have been taken. All of these initiatives have been to reduce the frequency of searches at Whitburn. Video conferencing was instituted so that there would be less times where they have to leave the institution and come back and be searched. Measures were announced to any youth picked up after 6 o'clock will not be transported from St. John's to Whitburn. We're reducing the number of searches used by the St. John's Detention Center, and windows were installed in the facility to allow for visual monitoring at the St. John's Detention Center. Staff of the Youth Center, in collaboration with the department, are now in the process of developing new policies based on the 16 recommendations of Ms. Poirier and Mr. Brown. New policies will provide for searches that will be less frequent, less intrusive, and will take into consideration the recommendations of the consultants and the sensitivities of youth, of gender, and of culture. I'm pleased to announce today that a tender is being prepared to provide all correctional officers in Newfoundland and Labrador with protective vests to be worn while on duty. It is our hope to have this completed by the end of the fiscal year. This issue has been a significant one for correctional officers. Recently, while attending the Correctional Officers Component Convention, this was made very clear to me. And further to this, also suggested by the consultants, the department will be purchasing collapsible batons to be used by correctional officers during escorts to and from correctional facilities. This is the right thing to do to protect our employees. I'm also announcing today a partnership with 4 community-based organizations which have a keen interest in helping inmates. Stellarbury Community Services, Turnings, the John Howard Society, and the Canadian Mental Health Association of Newfoundland and Labrador will be engaged by the Department of Justice to help us better serve inmates and correction officers. We've committed $200,000 this year to do so. Stellarbury Community Services will provide in-reach and addictions programming to inmates of the Newfoundland and Labrador Correctional Center for Women. They will also develop a comprehensive long-term plan for enhanced programming and supports for female offenders. Turnings will provide drug awareness and prevention education programs to the community and continue the fine work they do with offenders struggling with addictions. Turnings will also focus upon the families of inmates with drug addictions and provide much needed support. The John Howard Society will provide anger management counseling to inmates along with relapse prevention programs. The Newfoundland and Labrador branch of the Canadian Mental Health Association will provide their Changing Minds mental illness education program to correctional staff at all Newfoundland and Labrador prisons. At the West Coast Correctional Center, the Bishops Falls Correctional Center, and the Labrador Correctional Center, the department is developing contracts for local artisans to teach art to help improve the skills of inmates. Hobby shops at these facilities will see increased activities with a specific focus on Aboriginal inmates in Labrador and the production of snowshoes, drums, and tents to be used in future cultural ceremonies. As you can see, much work has been undertaken and much cooperation has been ongoing. It will take time. This is a first